Disclaimer: this video is for educational purposes only and not to be used as a substitute for medical care advice.
He's 52 years old. He runs 3 times a week. His last checkup was normal, his cholesterol was fine, and he has never once had chest pain in his life. Then, halfway through a routine Saturday morning jog, he simply collapses. No warning, no crushing pain beforehand. One moment he's running, and the next, his heart has stopped. This isn't a rare freak scenario. This is how heart disease actually kills half of the men and nearly 2 out of 3 women it affects, with no warning symptoms at all beforehand. Not chest pain, not a checkup that catches it in time. Just silence, right up until the moment everything changes. How is that possible? Because your body is remarkably good at hiding exactly this kind of danger. It can mask a blockage covering 90% of an artery, keeping blood flowing normally, right up until the second it doesn't. In this video, I'm going to show you why a seemingly healthy heart can fail without warning, how your body hides these blockages so effectively that even doctors can miss them on a routine visit, and the one number that actually predicts your real risk far better than a standard cholesterol test. I'll also explain why this matters more once you're past 45, especially for women, because something shifts in your risk profile around this age that almost nobody talks about. And by the end, I'll give you a specific list of symptoms that could save your life, or someone else's, so stay with me until the end for that. Before we dive deeper, let us know where you are watching from in the comments. Here's how we'll break this down. First, the anatomy of exactly how and where these blockages form. Then, the biggest misconception people have about how heart disease actually progresses, one that gets people killed because they expect a warning that never comes. After that, why this risk changes specifically after 45, especially for women. Then, the actual number that predicts your risk. And finally, the exact symptoms to watch for, in yourself and in the people you love. Let's start with the anatomy, because understanding it is what makes everything else make sense. Your heart is a muscle that demands more oxygen than almost any other tissue in your body, and it gets that oxygen through a network of vessels wrapped around it called the coronary arteries. One vessel in particular, the left anterior descending artery, carries a grim nickname in emergency medicine, the Widowmaker. It supplies blood to the front and bottom of your heart's main pumping chamber, so when it becomes blocked, the consequences are severe and immediate. So how does a blockage form, even in someone who exercises regularly and eats reasonably well? A healthy artery is flexible, with a smooth inner lining that blood moves through with almost no friction. Over decades, factors like high blood pressure, high blood sugar, and smoking gradually damage that lining. Even the mechanical stress of very high-volume exercise over many years can contribute microscopic wear. Your body responds the way it responds to any injury. It sends cholesterol to patch the damage, and immune cells arrive to clean up the site. Over time, this hardened mixture of cholesterol, calcium, and cellular debris becomes plaque. This process is called atherosclerosis, and it's the foundation of nearly everything we're about to talk about. Now here's the misconception that catches so many people off guard, and it's the reason this topic deserves real attention rather than a quick dismissal. Most of us picture plaque buildup like a clogging drain, narrowing gradually until the flow just stops, and we assume we'd feel that happening along the way, a little more breathless each year, some warning sign building up. That assumption is logical. It's also wrong. As plaque grows, the artery wall often stretches outward to compensate, actually preserving normal blood flow around it. This is called positive remodeling, and it means you can have significant plaque buildup while still having completely open blood flow and 0 symptoms. You can run, feel fantastic, pass a basic physical, and have no idea anything is wrong, which is exactly why sudden cardiac events are so often the very first sign of a problem that had been quietly building for years. So what actually flips the switch from silent to sudden? It comes down to stability, not size. Some plaque is soft, covered by a thin, fragile layer, almost like a blister. A sudden spike in blood pressure, or intense physical exertion, can cause that thin covering to tear, spilling inflammatory material directly into the bloodstream. Your body reacts the way it would to any open wound, rushing platelets in to form a clot. That response is exactly what you want if you cut your finger. Inside a coronary artery, that same clot can rapidly seal the vessel completely. This is a classic heart attack, and unsettlingly, it's often triggered by plaques that weren't even large enough to cause any symptoms beforehand. In fact, the majority of heart attacks happen in arteries that were less than 50% blocked because it's the unstable, softer plaques that rupture, not necessarily the largest ones. There's a second, less talked about scenario that matters a lot for people in your age range, especially active people. Picture a disciplined 50-year-old runner with completely normal cholesterol. During a race, he doesn't feel any crushing chest pain, just unusual fatigue, lightheadedness, and nausea, which he assumes is dehydration. At the hospital, doctors find elevated troponin in his blood, a protein that leaks out when heart muscle cells become damaged. But when they examine his arteries, they find only a 50% blockage, nowhere near fully closed. So how did he have a heart attack with blood still flowing? This is a supply and demand problem. At rest, a 50% blockage is barely noticeable, the artery is narrowed, but enough blood still gets through to meet demand. But when his heart rate spikes during intense exercise, demand for blood increases dramatically, and a partially blocked artery simply can't keep up with that request. This is called ischemia, and it's a powerful reminder that risk isn't only about how blocked an artery is, it's also about how much you're asking your heart to do, and how prepared it is to meet that demand. This is exactly where I want to talk directly to those of you watching who are over 45, and especially the women in that group. For men, cardiovascular risk tends to rise fairly steadily with age, and it's often on people's radar earlier because of that gradual climb. For women, something different happens, and it catches a lot of people off guard. Before menopause, estrogen offers meaningful cardiovascular protection, which is part of why heart disease tends to appear later in women than in men on average. But after menopause, that protective effect fades, and women's cardiovascular risk begins climbing sharply, often catching up to men's risk within just a decade. And critically, women's symptoms are frequently different from the textbook version most of us picture, and far easier to dismiss. Extreme fatigue, shortness of breath, even something that feels like ordinary indigestion. If you're a woman past 45 and something feels different or off in a way you can't quite explain, that's genuinely worth taking seriously, rather than brushing aside as stress or aging. Now, here's some real, grounded good news in the middle of all this. Your heart has a natural backup system called collateral circulation. Think of your main coronary arteries as highways. If a blockage develops slowly enough, over years rather than suddenly, your heart can gradually build smaller side vessels that reroute blood around the blockage entirely. This is a major reason older adults sometimes survive blockages that would be catastrophic in someone younger, whose heart simply hasn't had time to build those detours yet. And one of the most effective, evidence-backed ways to encourage this kind of vessel growth is through consistent exercise, a mix of steady cardio and higher intensity training over time. In the emergency room, we have a saying, time is muscle. Within about 20 minutes of a full blockage, damage begins. Within 90 minutes, that tissue can become permanent scar tissue that no longer pumps. Recognizing symptoms early and acting on them immediately isn't overreacting. It's exactly what protects the heart muscle you still have left to protect. So let's get to the number I promised you earlier, the one that actually predicts your risk better than standard cholesterol testing alone. It's called a coronary artery calcium score, or CAC score, and it's a quick, low-radiation CT scan that directly measures calcified plaque sitting in your coronary arteries. A score of 0 is a strong sign of low risk. A score above 400 signals significant, established disease that genuinely needs attention. Unlike a basic blood panel, which only tells you what's floating around in your blood, a CAC score tells you what's actually accumulating in your artery walls right now. For anyone in their mid-40s or older, particularly if you have risk factors like high blood pressure, high blood sugar, or a family history of heart disease, this is a conversation genuinely worth having with your doctor at your next visit. And now, the part I promised to save for the end, because I want it to be the thing you remember most. Here are the symptoms worth knowing, for yourself and for the people around you. For men, the more classic pattern includes chest pressure, or tightness, and pain radiating down the arm. But for women specifically, watch for extreme, unusual fatigue, shortness of breath without exertion, nausea, or a persistent sense that something is simply wrong, even without any pain at all. If you or someone near you experiences a sudden, overwhelming sense of doom alongside any of these, do not wait it out. Every minute genuinely matters here. So here's what this all comes down to. A healthy-looking, symptom-free body doesn't guarantee a healthy heart. And by the time symptoms appear, plaque has often been quietly building for years. Controlling blood pressure protects the artery lining itself. Managing blood sugar reduces the inflammation that drives plaque formation in the first place. Staying consistently active helps your heart build its own natural backup system over time. And knowing your CAC score gives you real, concrete data instead of guesswork about where you actually stand. If this helped you understand your own heart health a little better, hit the like button and let me know in the comments, have you ever had a coronary calcium score, or is this the first time you're hearing about it? Subscribe to Health Reprogram so you don't miss next week's deep dive. I'll see you in the next one.